I was born and raised in Brazil, specifically northern Brazil, which is right in the Amazon rainforest area. So my whole family is there. Went to med school there, then moved to Michigan in 2021. In Michigan, I completed my internal medicine residency at Western Michigan University, which is in West Michigan in Kalamazoo, and then went for my fellowship at Henry Ford Health in Detroit. When I was in school, I was very curious, and I just found it fascinating, like human anatomy, physiology, how diseases affected us. I thought it would be a good field for me with all my curiosity. I had no idea infectious disease was even a thing. I didn't know there was a specialty dedicated to care for infections until I actually started medical school and started interacting with infections and all the diseases that can be caused by bacteria, parasites, fungi, viruses, and how much we have progressed within the past century to treat people with new antibiotics, how we can help people prevent diseases with vaccines, I think is all fantastic. We can do so much and help our patients. It's never a dull day. It feels like a detective's work within medicine, which is fantastic. And we don't solely focus on an organ or a system. We take care of patients and as a whole, which I think is what I envisioned when I chose medicine as a career. Oftentimes, we'll get referrals from people who saw their primary care doctors or they saw an internal medicine doctor in the hospital. We'll see people for infections affecting the urinary tract or people with infections that cause diarrhea, chronic infections. We'll see people who, are about to start a medication that depress their immune system and we need to make sure they're cleared from an infection standpoint. We work very closely with surgeons too, with cardiologists. There's orthopedic surgeons as well. We know there is a risk of infections in certain settings that are associated with certain procedures. So we definitely do a lot. It's a very vast field. Patients go through a lot when they pursue healthcare, and I feel we need to empower our patients in the sense that I'm gonna make sure I treat you without bias and that you can make a decision in your care. My job is to make sure you feel comfortable. My job is that you understand why I'm suggesting what I'm suggesting so that together we can make a decision. I think that's how it goes, and I think that's how modern medicine should work. When it comes to Avera, I just found a very supportive environment overall. I found a healthcare system that cares about people, that puts people's well-being first, regardless of anything. So for me, that was an immediate yes. One of my favorite hobbies, I guess trying new food and traveling and, just spending time with my boyfriend, with my rescue animals, my 3 cats and 2 dogs.